morning, everybody, and we're so excited that you're here with us. When we were talking about what to do about the Children's Environmental Health Summit this year, we were a little disappointed that we weren't all going to be able to be together face to face, but this has turned out to be a really good option for us, and we're actually reaching people that wouldn't have been able to come if we had, had a all day long meeting somewhere in Kentucky. And even today, we have some folks that are registered that are not from Kentucky. So I'm very excited to welcome all of you. We have a great program today. So I'm the executive director of the Kentucky Population Health Institute. We co-host this with folks at the, I'm going to show you all the sponsors, but at the Department for Public Health here in Kentucky, who run our tracking network, which is called Enviro Health Link. So I'm going to show you an introductory slideshow about the program that we have between now and in December, and then we'll get started.
Hello, and welcome to the Kentucky Children's Environmental Health webinar series. The purpose of this series is to help participants increase their knowledge of environmental exposures and how to reduce these for children. We would also like to introduce you to our Environmental Public Health Tracking Data Portal, which you can access by going to envirohealthlink.org. This easy-to-use website can be used to find Kentucky-specific health and environmental data. We want to say thank you to our sponsors for their support: the Kentucky Department for Public Health, the Environmental Public Health Tracking Program, the Kentucky Environmental Education Council, the Kentucky Asthma Management Program, the Kentucky Population Health Institute, and the University of Kentucky's Center for Appalachian Research and Environmental Sciences. And finally, we would like to say thank you to our planning committee, whose valuable input and expertise has made this series possible. We hope you enjoy our webinar series.
Great, so thank you for that introduction. And now I'd like to turn things over to Shelly Canada, who's going to introduce our speakers for today. So Shelly.
Hello and welcome to today's webinar. I'm Shelly Canada. I'm with the Environmental Public Health Tracking Network, and we are very excited about our speakers today. The topic today is Early Environmental Exposures, a Community Science Toolkit. And it is my great pleasure to introduce Nancy Jeffery, who is my counterpart in the tracking network in New York City. Nancy is the Director of Outreach and Senior Program Manager for the Bureau of Environmental Surveillance and Policy at the New York City Health Department. She has 29 years of experience working in the field of environmental public health and has conducted and managed numerous environmental and occupational health investigations. Ms. Jeffery has conducted risk communication in response to environmental emergencies and has created and overseen the development of educational materials on a wide variety of environmental health topics. In her role as Director of Outreach and Senior Program Manager, Ms. Jeffery has contributed to peer-reviewed publications and written successfully funded grant proposals and conducted outreach on a variety of public health topics. Our other speaker is Luce Guel, who is the Community Engagement Coordinator for the Mount Sinai Transdisciplinary Center on Early Environmental Exposures. Her mission is to foster collaboration and communication among environmental health scientists and stakeholders on the role of environmental exposures in children's health. Through academic and community partnerships, Luce communicates environmental health research findings to community members and ensures that the environmental concerns that affect the community health to guide the center's research. Welcome, speakers, and thank you for being here today. I'm going to turn it over to you, Nancy.
Hi, everybody. I'm just going to set up my presentation. Just bear with me for a minute. Okay, hopefully you can all see the screen there. Thank you to Kentucky, and we particularly wanted to say thank you so much to the Kentucky Department of Health and the Kentucky tracking team for inviting Luz and I to come and speak with you all today. We were hoping to go and be there in Kentucky in person, but this is the next best thing. So thank you so much for inviting us to come to your webinar series today. Just wanted to give you a brief introduction to our team. This group is, this project that we're gonna be talking about today is really a very collaborative effort. We worked closely with Maida Galvez and Luz Guel from the Mount Sinai School of Medicine. And also the two people here at the health department who really worked closely on this project was Maggie Rice and myself, and our air and health team here. Maggie Rice has left the agency in January, so she's no longer here, but a lot of this work couldn't have been possible without her contribution. So as Shelly and other people have mentioned, both Kentucky and New York City are members of this CDC's National Tracking Network. The network really brings together data on a variety of sources and information about the environment and health as a way to pull this information together and help guide and direct public health actions. And some of the ways the grantees who are in the program use the data to help drive actions is we really communicate our data findings with our partners in city and state agencies. We also take a look and analyze the data to get a sense of where exposures are happening, who are being mostly impacted, and then we communicate that information to help programs and policies inform the development of different policies to help address some of these environmental health issues. And then the third way we really do this is we try to respond to community concerns, and we do that by here at New York City. The approach we've taken is we try to provide data and information to help communities address some of their own environmental health neighborhood conditions that they are concerned about. So just a little bit of information here is that both Mount Sinai and New York Health Department really realized and have been working together on various projects, but one thing we all have in common is that we really are trying to help communities learn about New York City's environment. We applied for, together as a team, we applied for a small grant, and that has led to the development of the My New York City Air program. And the program really evolved over time. Originally, the idea was that we would create an app for communities to use to collect and share their own data. And as we got a little bit more into understanding about community science, we realized that there already exist a lot of tools that are free and online and that people are already using. So rather than create our own app, we looked at this approach as trying to create tools to help communities lead their own research and really kind of support community groups in being part of these scientific questions and development and analysis, interpretation, and all the way through to the end of the scientific process. So the program really consists of 3 main modules. It also just kind of helps community groups and teachers and school groups understand how they can take the research and the data that they've collected to action. And we here in New York City focused on air pollution as the main example. But the idea is that this same process can be applied to in many other environmental concerns. It's just that the one we're going to be talking about today focuses on urban air. The goal of this program is really to enhance the capacity of frontline communities. We really want to help them take a look at, understand more about their environment, and then proactively identify and then try to figure out how they can address local sources of outdoor air pollutants, and then introduce them, help them learn how to use free community science tools. So the three main trainings that are part of our toolkit really introduce people to the concepts and information and science about environmental health and justice. And then we go into, sorry about that, we go into some trainings on how to collect their own data, how to use some of the tools that are available, and then how to actually analyze and interpret the data that is being collected by the group. And then we walk them through examples of how people have been able to take their findings and come up with a plan for taking an action. So again, I'm going to go back a little bit to why did we decide to focus on outdoor air pollution as a public health concern? Well, it turns out that fine particulate matter, PM2.5, is one of the most important urban air pollutants for people living in the US and in large cities. And the reason for this being a big important health concern has to do really with the size of the particle. The size is so small, whoops, I'm gonna go back. The size is so small that particles in the air of the size of 2.5 or smaller microns is able to be deeply inhaled into the body, and those particles themselves and any other materials that are attached to those particles can contribute to the development of strokes. They can also have a role in cancer causation, cardiovascular disease, and worsen lung disease and people who have asthma. The way we're using our tracking, this is that's a screenshot really from our tracking portal that we have here in New York City. We call it the Environment and Health Data Portal. And we really have tried to provide the data at different ways to try to meet different users' needs. But essentially, people can go on and explore the data as individual indicators of a topic. They can also get almost what you would call curated neighborhood reports that pull together data on specific topics. And that's a little bit of a more easy one way to get your data already pulled together for you on a topic of concern. And then the third way is we found that to try to help people understand how the environment can really impact our health, we have a great team of data communicators, and we try to develop data stories. We do those through infographics, but also through actual online data stories that pull together the information in a way that hopefully people can just read and understand how important these public health issues are. So for our My New York City Air project and for community science, what we have been seeing is that we introduce groups and school groups to the data as a resource and as a reference, data reference tool. And you're gonna walk you through, just show you what the neighborhood reports look like to kind of give you a sense of that. So on our data portal landing page, you would go to the neighborhood report section. You'll get a map. You can choose what topic you're interested in. And the one we're going to talk about today, obviously, is outdoor air and health. And then you can go over the map to choose your neighborhood or a drop-down list. And these are two separate neighborhood reports. They give you a sense of, they pull together data that we have available on the topic of outdoor air and health for East Harlem. I'm going to focus on the left. It gives you just kind of a one-page report, quick way to look at it. The outdoor air pollutants, and then the health burden, and there's actually a little bit more as you scroll down, but you'll get a sense here to see what are these levels looking like of the environmental hazards in your neighborhood. How do they compare to the borough that you're living in? And how does your neighborhood and the borough compare to the city's overall rate or percent or number, depending on the indicator? And then you get a brief little ranking. Is your neighborhood doing worse? Is it about in the middle, or is it doing better than other New York City neighborhoods? And really it kind of helps community groups understand where there are issues in their neighborhood that actions could be taken on, but also where maybe they thought there were problems, but actually they're doing better compared to other neighborhoods. So it kind of gives you a bit of a reference. That's what we're trying to get at. One thing we've realized and recognized is that although we have a lot of data in the tracking program, there are still data gaps out there. Especially, we are not able to address some local concerns that communities have about outdoor air pollutants. And those were things such as idling cars, for example. These are very transient sources of outdoor air emissions, but they do make a big impact in quality of life and also health for people living in neighborhoods. And in New York City, we have idling restrictions, but it can be a little tricky to enforce them because they are transient. So it kind of lends itself very well to the idea of a community science tool. If you're able to record and use a smart camera, you would be able to record and see that there is idling happening for several minutes in front of a school or in this particular neighborhood. And if you document it, and there are ways to share that information with the city, and they will do enforcement, take some actions on trying to crack down and make sure people are aware of other outdoor air pollutant issues. We also kind of share with our community groups and with our school groups that are interested in doing community science a little bit about our New York City Community Air Survey. We're very lucky here to be able to have a lot of data that's collected on an ongoing over many years of air monitors that are at the street level and that are sprinkled throughout the city. And whoops, gonna go back again. So, and then by having this ongoing monitoring, what the city has been able to do is to show and look and being able to analyze where are the primary sources of emissions. We've been able to really make huge improvements in the urban air quality in New York City. It's now been a 10-year ongoing survey, but we've been able to decrease by 30% our fine particulate matter, our nitrogen dioxides, our black carbon. We've also made huge impacts on decreasing sulfur dioxide. And the reason this has gotten down so much and dramatically is that there's not just city efforts, but regional, state, and federal efforts were put into phasing out of the use of heavily polluting building heating oil. So it's kind of, we walk through that as a process by regulating and phasing out the use of this heavy oil in wintertime. We have seen a huge impact in the amount of emissions for sulfur dioxide in the city's air. And we're just trying to illustrate for community groups and for teachers that by monitoring, by interpreting, by comparing it with other areas, and then sharing that information out to decision makers, changes can be made to help improve our environment. And I'm going to turn it over to my colleague Luz to continue on the presentation from here.
Yeah, so hi everybody. So I think what I'm going to do is I'm just going to share my screen, Nancy, so then I don't have to keep saying like next.
Okay, sure, sounds good.
So let me do that. All right. Awesome, and thank you so much, Nancy, for really starting this presentation by just giving a background as to how we got involved in this project. And we're very, very fortunate to have amazing partners like Nancy as part of this program. And again, my name is Luz Guel. I am the Community Engagement Coordinator for our NIHS-funded Environmental Health Center at Mount Sinai. And I also want to acknowledge that I'm standing on Lenape land. I always like to start a lot of my conversations by acknowledging specifically where I am sitting when it comes to native land. But yeah, so now I'm going to turn it over and kind of switch as to why we ended up doing community science work, but also how this plays a huge, why we end up doing community science is to be able to address some environmental injustices that are happening in our communities. So in the US, as many of you know, specifically working in environmental health, is that people of color, low income, and tribal populations are disproportionately exposed to environmental hazards that can affect their health or make existing health conditions worse. And so to just give you a bit of a background as to the populations we're working with here in New York City, we're going to be using some of this data that Nancy was speaking about as to why we end up focusing certain neighborhoods compared to others. But as I had mentioned before, with environmental injustices, we know that race is one of the biggest predictors of a person living near contaminated air, water, or soil. And when we start looking at the data using the environmental health data portal within New York City, we start to look at which neighborhoods are having the biggest burden when it comes to pollution or other environmental toxins. And we know that these neighborhoods are predominantly Black and Latinx communities. And so here we see how some of the highest air pollution exposures within New York City happen to be in Monhaven, which is part of the Bronx, which is one of the boroughs here within New York City. And they happen to be, like I said, specifically Black and Latinx. When we also start looking at data, we also know that zip code determines your health. So when we have two different neighboring neighborhoods, and if you're not familiar with New York City, we have the Upper East Side and East Harlem. Upper East Side historically has been a wealthier white neighborhood compared to East Harlem that has been historically Latinx. And when we start looking at the life expectancy of these two neighborhoods that are just adjacent to each other, we notice that there is an 8.6-year difference of life expectancy. And so when we start seeing this data, we have to try to understand what is driving all these different environmental health disparities, but also driving these health outcomes that end up reducing our life expectancy overall, specifically for Black and Latinx communities. And so when we start to talk about a lot of these issues, we have to be able to name exactly what is driving these issues. So environmental racism is the disproportionate impact of environmental hazards on specifically BIPOC, which stands for Black, Indigenous, and People of Color. And environmental justice seeks to remedy all that by ensuring that everybody, regardless of their background, race, religion, are able to participate meaningfully in the creation of these laws and policies, but also that their health is protected moving forward. So really making sure that environmental justice is the center of all the work that we do so that we can address environmental racism that is driving these health outcomes to be poor in these specific Black and brown neighborhoods. And so I think whenever we start talking about this, a lot of people are like, oh, you know, like this all just happened by accident and this all just, you know, somehow all came together. But when we start to understand the history specifically of the United States and just in global context, we start to understand that all of this was not by accident, and our current environment was shaped by racist policies that created systems of imbalanced power and privilege. It was also historical practices of exclusion and discrimination across the life course. And it was also geographic concentration of poverty and segregation. So we know that not everybody's breathing in the same air, and a lot of these different racist practices that happened since the beginning of the creation of this country, then we know that those are the ones actually driving a lot of these health outcomes. And so one of these practices that we like to highlight specifically within New York City is redlining. And this redlining really has shaped the landscape as to why we end up having these negative health outcomes, specifically for Black and brown folks. And to just give you a quick history of redlining, in the 1930s, the US government drew maps to decide which neighborhoods and cities were too risky for mortgage loans. And the areas made up primarily of people of color and recent immigrants were outlined in red. So if you were to see out throughout New York City, all the different red areas would be specifically Black and brown immigrants that recently came to the United States, and those were specifically deemed as hazardous. And this practice ended up cutting communities of color from mortgages, stable housing, and wealth creation for decades. And this disinvestment of redline areas exacerbated poverty and displaced people of color for interstate highways. So for example, within the borough of the Bronx that I had mentioned before, the one that you kind of see here as part of this presentation, when a lot of reinvestment was being done within New York City, instead of creating more resources for the Bronx and the people there that were specifically Black and brown, instead they ended up building a highway. So it incentivized cities and city planners to, instead of protecting the communities that already live there and being able to create other sustainable alternatives, instead put highway there that continued to segregate and split up a lot of those communities that were there for a very, very long time. And so it's important for us to start thinking about how these systems of oppression and the systemic issues over time end up driving inequality in different neighborhoods throughout New York City. And again, like these communities specifically that have been redlined continue to be routinely selected for dumping grounds. So whenever we start looking at other maps and seeing where waste transfer stations are located, where other toxins are placed, or specifically are placed in redline neighborhoods. And so here are some maps when it comes to poverty in New York City, childhood asthma, and particulate matter. And again, when a lot of folks end up talking about these issues, they're like, it happened such a long time ago. Like, this cannot necessarily be impacting us right now, but actually it is currently still impacting the health of our communities. When we see it in relation to poverty, all the red line areas, as you can see, you can start seeing that still is in existence today. When we look at childhood asthma, those red line neighborhoods continue to have these disproportionate burdens of pollutants such as particulate matter, which is what Nancy was talking about earlier. And of course, this particular matter ends up exacerbating asthma and making some of these health conditions worse for folks that are already under poverty and like cannot be able to sometimes access affordable health care. So as you can tell, this cycle continues going on. And it's so important for us to talk about these historical practices because it ends up being the root cause of a lot of the health inequities that we see within New York City. And so again, like a lot of us focus on equality, but equality doesn't necessarily get us there. Equity also is another framework that is so important for us to embed into our work. But again, it doesn't get us to where we want to be, which is liberation. And the reason we like to focus specifically on liberation, because again, it gets into the root causes of a lot of these environmental hazards that are being placed specifically on Black and brown communities. And for us to be able to truly address these public health concerns, we need to be able to name how these systemic systems ended up impacting the health of our communities. And so as part of this community science program, what we do as part of the environmental health and justice training is really highlighting these root causes of systemic racism and how they end up shaping the environment that we currently have today. And really try to make a point of trying to bring into light how these issues need to continue to be addressed and named so that we can be better about how research is being done at the community level as well. And so that really brings us to why we ended up using smartphones and technology and why we ended up getting into community science is that there's so much available data now. There's also technology that we can end up using to be able to tell the fuller picture as to what is driving these health outcomes at the ground level. So one of the tools that we end up using as part of this community science program is smartphones. A lot of us have them. A lot of folks end up having somebody else who knows might have a computer or might have a smartphone, but we also develop a partnership with public libraries because we do know that not everybody has access to phones or technology to be able to drive a lot of this work. So we ended up purchasing separate iPads as well for folks that didn't have the technology access to be able to still collect data by partnering with a public library so that we can do like a lending program so that they can check out, for example, a low-cost air sensor and an iPad so that they can be able to collect data on the ground level. So what is community science? I know that some of you might have heard the term citizen science instead of community science. Our program decided to change that terminology due to the fact that citizen is still a very triggering word for a lot of folks, and specifically undocumented immigrants that happen to be here in the United States. And the last thing we want is for anybody to feel ostracized or not be included as part of community science, when really the main purpose of community science is to make sure that everybody, no matter what background you're from, that you're able to participate in the scientific process. So community science is the scientific research and monitoring driven by and controlled by local communities. And it's characterized by place-based knowledge, social learning, collective action, and empowerment. So I know that a lot of us use empowerment, but we really want to try to rephrase that as empowerment, because when we use the word empowering, we're kind of signaling that we are holding power and we're somehow giving it to people, again, saying that we are somehow controlling the power of other folks. So empowering really makes sure that whenever we're talking about this, we're just activating the power that people already had instead of us trying to give it to them. Because again, that gets into some power dynamics that don't end up creating good relations and trust with community members. We also collaborate with communities to be able to answer real world questions. And it really focuses on the scientific process and making it as accessible as possible. And of course, there's very different benefits as to why we want to do this and why we want to continue creating community science. But one of the main reasons why we ended up focusing on community science is because it really does end up contributing to research. And oftentimes we focus so much on what academic institutions are leading, but not so much what the people on the ground are dealing with every single day and how they can drive this research to kind of create change and action at the local level. And so this gets to the notion of who is a scientist. And so there's a stereotype of traditional scientists as working in a lab with a big white coat with goggles or holding a beaker. But when it comes to community science, we don't operate in that lens. When we think about a scientist, we think about somebody who happens to be an everyday person just walking down the street that happens to know the scientific process and can be able to engage in that way. And that you don't need to have an advanced degree to be able to contribute to science. Because again, who is able to access education also has a lot of other implications, and we can talk about that in a whole separate presentation. But the reason why we end up focusing again on community science is because it allows anyone to be able to participate in the scientific process and allows everybody to feel as though they also themselves are a scientist. And so again, I want to reiterate that a degree does not make you an expert on somebody else's experience. And so for us to be able to continue working within community science, we must make science open and accessible to everyone. And community members are experts of their own neighborhood and bring a wealth of knowledge to research initiatives. So as part of community science, we really value community members as experts and as them knowing the best solutions for their own neighborhood, as compared to a scientist coming into a neighborhood and telling them what to do. That is not the approach that we take within community science. It is completely the opposite, where we end up learning from community members and we learn from their expertise instead of vice versa. And so community science, again, allows those most affected by environmental issues to use their expertise to organize, lead research, and take action in their own neighborhoods. And this is what a community scientist looks like. So here you see various groups end up collecting environmental health data and environmental science data throughout New York City. And as you can tell, everybody looks so different. And this is what really we want to focus when it comes to community science, is that anybody can be able to participate regardless of their background, and that they're all doing really meaningful research that is going to hopefully contribute to a betterment of our neighborhoods and also create healthy neighborhoods for everyone. And so community science is not a new concept and has been around since the beginning of civilization. So I think that there's also another misconception that community science is something new. And I think it became very popular, of course, in recent years, but it really has a long history when it comes to human history as well. So some of the examples as to how community science has been used is that we can look at how indigenous communities passed down generational knowledge about medicinal plants. Individuals collected butterflies and classified them. Civilizations visualization study the stars, there's bird counts that a lot of other groups have been doing for a lot of years. All those are very different forms of community science. But one of the main reasons why this concept really became very, very popular was because of technology. So now that we have smartphones and the internet and all these new web platforms that are able to allow folks to be able to share this data, now more people are able to connect with each other and be able to organize and lead some of this community science research because of technology and how it's able to easily connect folks from very different regions, because we sometimes even have some platforms that allow you to connect internationally. So how do you end up comparing a neighborhood here within the United States with one, for example, in Belgium, and what that might look like? But technology has allowed us to be able to do those type of comparisons because we have these new platforms that allow us to share this type of data. And so there's very different levels when it comes to community science programs, and they're all classified differently depending on the level of engagement. So we know that not every community science program might have the bandwidth, the capacity, the funding to be able to lead such a robust scientific process when it comes to the community level. So there really is a menu of as to what you can choose when it comes to the capacity that that community group might have. So there's level 1, which is just crowdsourcing, which means just folks are just collecting data. There's level 2, which means the community members are the ones that are helping to interpret the data. There's participatory science, where community members help with the problem definition and data collection, but not necessarily the analysis part. And the one that we focus the most of when it comes to this program is extreme community science, which is where we collaborate with community members in the problem definition, the data collection, the analysis, the reporting back, and the action piece. So as you're thinking through what community science might look like in your own neighborhood and the work that you do, it's really important to see and analyze what the capacity is for that community group and see where you can end up using this process to be able to enact action and change in the community level. And so as part of the community science program, and I think that Nancy already kind of alluded to this, is that we end up doing a training step by step as to how do you end up leading research and taking it to an action. So as part of that training module, we go over step by step, how do you identify an environmental concern? How do you prioritize it? How do you create surveys? How do you collect data? How do you present that back? And we really try to embed best practices in all of these different steps by partnering up with other academic institutions that have been leading a lot of this work as well. And so when it comes to the technologies, the one specific one that we are focusing on and that it's freely available to anyone is the ONA platform. And of course, there's so many other community science platforms. There's SciStarter, there's eBirder, iNaturalist. So there's so many other platforms that you can end up using, but the one that we specifically use is the ONA platform. And the reason we ended up using it is because it's also freely available anywhere else in the country, but it also allows you to collect data without having to have internet connectivity. So we know that a lot of folks might end up being in rural settings and might not have the internet capability of being able to collect data and be able to do it in real time. So the ONA platform allows you to download the survey and be outside and still be able to collect geolocated data without having to have this internet connectivity, like I said. So whenever you end up getting to like a Wi-Fi spot, you end up just refreshing that specific survey, and then it launches it into the cloud, and then you can end up uploading that data. Another technology or specific technology piece that we use is the AirBeam, and there's so many other low-cost air sensors out there in the market, but the one that we use specifically is the AirBeam, and it was made by Habitat Map here in New York City, and it allows you to collect street-level air pollution data, specifically PM 2.5 and PM 10. And so some of our community groups ended up applying to grants to be able to get some of these, and also the Department of Health has some of these air quality sensors that community groups can borrow so that they can be able to do some of this data collection. So here again is the ONA platform, and it allows you to collect geolocated data, and you can be able to create whatever survey that you want to. And that's one of the things that we really love about this platform, is that you can really be as creative as possible when it comes to surveys and collecting also storytelling or collecting pictures as part of data, because sometimes we end up discrediting the storytelling and the pictures, the qualitative data aspect of a community science. So the ONA platform allows our community members to be able to take photos and storytelling and do audio recordings based on some of the features that they might see down the street. So for example, if they see a sidewalk that they end up passing by every single day that has not been fixed for years, they can be able to talk about and take a picture also of that specific sidewalk, and then later tell a story as to how that needs to be fixed, and then potentially then bring it up to 311 to be able to fix that specific feature within the neighborhood. And so there's very different ways that we can use online surveys to be able to collect data. It's really important for us to also identify the good things of a neighborhood and also the not so great. Again, this practice is super important because we really want to make sure that we preserve the really good things of a neighborhood, because we want to protect those and preserve them. But also we want to make sure that if there are really good things happening in a neighborhood and it's not happening in another, that this data could be used as an advocacy tool for other neighborhoods to be able to advocate for more green spaces or street trees because this other neighborhood has it. So how do we advocate for that data to be used for this neighborhood that looks different than that one? And so that we ensure that everybody has access to green spaces or street trees as well. But the surveys allow you to also collect some of the air quality hazards. So in New York City, there's a lot of construction happening, there's a lot of traffic, and then we also end up having these big trucks going through non-truck routes within New York City, and a lot of these trucks specifically go through red line neighborhoods. So historically, these neighborhoods already have a lot of environmental burdens, and plus we have these trucks that are emitting diesel fumes into their air. So then being able to take photos of that and document that is also super important so that we can make sure that that's enforced. And then we don't have these trucks going through neighborhoods that they're not supposed to. And so here is, here are a couple of templates that we've been able to develop. And as you can see, like when it comes to the menu of surveys that we've been able to develop with our community partners, it really does end up varying. We ended up creating a green space, a survey, a flooding one. And as we know, now we're getting more extreme heat events, but also a lot more flooding here within New York City. And so flooding looks very different at the street level than say, when you look at the AccuWeather or your Weather Channel app, and that doesn't necessarily tell you what actually is happening on the ground. So a lot of our community members were interested in documenting how flooding is happening at the local street level. There's waste management survey, healthy food access, noise, and asset mapping. So as you can tell, like it really does end up being varied when it comes to like the different type of surveys that you can end up developing. But this just shows you like the breadth of different surveys that we can be able to create using this platform. And here are some of our community scientists. So we've been able to work with the Huntington Breast Cancer Action Coalition, which is a youth group that are specifically looking at how youth have been impacted by COVID and how their stress levels have gone up or down, or how their sleep schedules have been altered. And they have been documenting a lot of this data for the past 4 months. Yeah, 4 months. And they're going to be presenting a lot of this data back to their peers, specifically in the next month. And they're going to be presenting how specifically COVID has like altered their sleeping schedule and how they were able to cope through all that. So we're very, very excited to see what they end up doing with that specific action piece. But as you can tell, they didn't necessarily focus on air quality. They ended up focusing on a more immediate need that they wanted to research, which is stress and specifically sleeping patterns for youth during a time of COVID. We also had middle school students from the Red Hook neighborhood here within New York City that received the training. They were specifically going to be using the AirBeam to look at how their air quality has changed, and then use the environment and health data portal in addition to be able to analyze what's happening in their neighborhood. Then we have an individual student that is based also here in New York City. They are looking at how green cleaning products are being used more or less of, trying to investigate that here within New York City in the time of COVID. So we know that more families are cleaning and using cleaning products. And as we know, not every cleaning product has good health effects to us. They end up emitting a lot of these fumes that end up irritating our throat or our respiratory system. So the students in particular wanted to understand, are people using more cleaning products? Are they ventilating? Are they opening their doors or their windows whenever they're cleaning? So they're really interested in seeing what that looks like right now. Then we also have high school students. So we're working with the High School for Environmental Studies, and they were the ones who received a grant to purchase an additional 6 AirBeam devices and also Android devices that are paired to that specific AirBeam. And they were looking at also air quality around their neighborhood, but also specifically focusing on environmental injustices. So most of the students that we were working with are from Northern Manhattan or the Bronx, which, as I kind of alluded to before, those two neighborhoods were specifically redlined and have already all these compounded environmental health disparities. So they really were interested in seeing how air quality looks like at the local level and street level. Then we're also working with a rural group called Local Environmental Action Demanded, and they're based out of Oklahoma. And we specifically got involved with their work after I presented at a conference that they hold annually. And they specifically work with the Quapaw Nation, which is a set of 3 different tribal nations within Oklahoma. And they were really interested in being able to survey their community members in terms of well water quality. So as you know, when it comes to rural settings, it's really difficult for community members to be able to communicate with each other about specifically well water, and how do you end up informing them. So they wanted to be able to survey folks and also geolocate exactly where these surveys were taking place and organize their community to see if they could better understand, are people testing their well water? Are there any water quality issues that you've noticed within your well water? And that project is still ongoing right now. And we're hoping to be able to check back in with them in the next month. And then the other program that we were able to embed this community science approach was through the Children's Environmental Literacy Foundation, which is a community-based group that works with teachers and how to incorporate sustainability into their curriculum. And we were brought in as speakers and collaborators to be able to train the teachers on how to use specifically the ONA tool so that they could help their students collect some of this data and incorporate it into their curriculum. And this year they were not able to put the program together, but for the past 2 years, the teachers were trained on how to use this specific tool. And also, in addition, we were able to create educational materials because even something that like Nancy had mentioned, idling is a really big issue here within New York City. But what we had is a lot of students immediately were like, I see so many idling vehicles everywhere. And they wanted to like go up to people and like knock on their window and tell them to turn off their engine. And of course, there's a lot of danger where that can end up being a really sketchy thing for our students to do. So, and also we wanted to give the students an opportunity to be able to educate others as to how idling harms health. Because I think that when we ended up talking to a lot of the people who were idling on the street, they just didn't know that idling had all of these repercussions for our air and our health. So the students really wanted to create educational materials that they could give to people that were idling. So they provided them an opportunity to learn before they were reprimanded or before we ended up enforcing a law and all that. So just giving folks the opportunity to learn was really instrumental as part of this project, and seeing students kind of think through the best ways to be able to educate others as to how some of these air quality issues impact health was really remarkable to see. But yeah, so when we ended up going out on the street back when this is pre-COVID, when we were able to go out on the street, a lot of the students were passing out some of these flyers so that they could be able to educate others as to how idling affected health. We also developed an outdoor air pollution infographic, really trying to summarize exactly how outdoor air pollution ends up impacting our health, but also how can we end up reducing some of these exposures and giving just key evidence-based messaging so that folks also have these like tangible actions that they can take to be able to reduce their exposure as well. So as part of all this, and like I think that the main purpose of all this presentation is really getting down to the community science guide. So with partners, we're developing a community science guide that uses the characters from the environmental justice comic book Namaya's Lot and Venus Plan to share a step-by-step how to take research to action. So here's just a very brief preliminary sketch that we're working with Charlie LaGreca, who used to be a DC comic book illustrator and also is the CEO of Nerd Riot. And what he does is he ended up creating graphic comic books. So he ended up partnering up with Rebecca Bratsby from the CUNY School of Law, and they ended up creating Maya's Lot and Venus Plant with their law school students. So we had the wonderful idea that like these two characters have been amazing messengers, specifically environmental messengers, and are trusted within a lot of our communities. So we figured that it would be amazing to do something non-traditional, and instead of creating a community science guide that it's just like step-by-step and just words, we really thought that this is an opportunity for us to tell a story using also trusted characters that also look like our community members and are able to tell this from the community perspective, and again, ensure that community members feel as though they're the ones as experts as part of community science. So we're hoping to finalize this community science guide by this fall. So stay tuned. We're going to hopefully be able to share this with all of you, but we're super, super excited to be able to do this community science guide as a graphic novel instead of just, like I said, words or pictures, because this is very different realm for all of us. If you would have asked me a year ago if I would be creating a comic book, I would have been like, what? So now I'm creating a comic book, which is really exciting that I get to work with so many amazing folks to be able to tell this story. And so that leads us to, how does community science lead to action? So there's very different ways as to how community science can lead to action, but here are some of the ways as to how our community members have been able to summarize all this. So one of the big components of community science is bringing in awareness that ends up leading to behavior change. This data can also be used to reduce car and truck and bus idling around school. It also helps students, specifically youth, realize that they have power and that they're able to use this power to enact change in their community by using community science. Also, this data can help identify areas that need improvement. So I kind of talked about that sidewalk. Unfortunately, within New York City, there's a lot of our sidewalks that are not even. So a lot of our students were documenting that and trying to see if there would be ways that could be fixed. Advocacy for rerouting truck traffic. We can inform the placements of outdoor air monitors. So if some of our students end up finding out that there is a hot spot within the street level, then maybe we can end up informing the city level that there needs to be a placement of one of these state regulated air monitors at these locations. It also ends up allowing folks to be able to highlight how environmental burdens specifically are affecting low-income BIPOC communities. But also too, as we start thinking about community science, is really training future generations to start thinking in a very intersectional way. So how are all these different issues affecting the health of our communities? It's poverty, it's also systemic racism, it's all these other factors that oftentimes when we think about environmental health, we focus so much on public health, but not necessarily what is driving these environmental issues to happen. So it's been really amazing to see how students are able to put together some of their own personal passions and issues that they've seen in their communities and be able to enact change in that way and bring all those topics together in a really meaningful way. So as part of the final project, what we plan to do is be able to create a webpage that includes the training module. So the environmental health and justice training module, the community science data collection module, and the taking research to action. So all these presentations are going to be freely available to everybody to download. And if they wanted to lead their own community science, they have these templates that they can adjust so that they can fit the need of their community. We're also going to be including the community science guide, so that comic book that we're developing, which is going to share step-by-step how to create community science, include community science stories, and then share resources. And then the third other thing that we're going to include is the survey templates. So we're going to include all the other surveys that I kind of highlighted before. So the flooding, waste management, but also evaluation surveys. So as part of this program, we're also evaluating the training, the community science, and we're going to make those two evaluation templates also available for anybody who wants to be able to use that and evaluate their own program. And then the last thing that we're going to include are the infographics that I kind of shared before, the outdoor air pollution, the idling one, worksheets so that people can really start thinking through and ranking some of these environmental issues, and then curriculum. So as I kind of mentioned before, we work with the Children's Environmental Literacy Foundation, and we were able to work with them to create one lesson plan around air quality and how to use the ONA platform. So we're going to be putting that specific lesson plan within that webpage. And here are some resources. Nancy, do you have anything else that you want to add?
No, I think that's great, Luz. Thank you so much.
Mm-hmm. Yeah, and that would be it.
Yeah, so we're open for questions if people have anything that they'd like to ask us about. I also think that there are, we're kind of showing examples of how we've done this in an urban environment, but we realize other areas that maybe more rural or more suburban have different concerns. But I hope you guys can see that this concept can be very applicable to different situations that you might be in the counties or areas where you're living.
Okay, we did have a question, and I think you kind of addressed it. The templates that you referred to, did you create those templates using ONA?
Yes, yes. So all the different survey templates were all developed using ONA. And the way that we ended up developing some of these templates is actually just finding peer-reviewed articles, and we kind of guide community members through that as well, that I think that's like very intimidating whenever you're trying to collect data. It's like, how do I develop a survey template? And what we know through research and peer-reviewed articles, a lot of them end up sharing some of those templates as part of their methods. So we end up just replicating and citing them whenever we end up creating these survey templates.
Okay, and we also have another question. Do these training modules talk about some of the things that you mentioned, like redlining and more? Because a lot of folks, you know, they're not aware. I wasn't aware of redlining, so that they can better understand what you're trying to do.
Yes. So yeah, that's the big, that's the reason why we ended up putting environmental health and justice, because we understand specifically how a lot of these concepts are not really ever really talked about or even addressed within public health. So we really wanted to make sure that community members felt as though having this knowledge also creates awareness, but empowerment, so that they are able to better address some of these concerns at their community. And something else that we've realized as part of this training is that because we're specifically focused on working with BIPOC communities, a lot of them, they just didn't know that this was happening. They could see some of these issues happening in their community in relation to environmental injustices, but they couldn't necessarily name them. So one of the things we've seen as part of this training and introducing these concepts is they're like, yes, like that is what I've been seeing in my neighborhood, and I finally have a name for it as well. And so it ends up creating a peer-to-peer mentor and also education with others. So what I've seen a lot of students do is then use a lot of this knowledge and then share with other students, and they're like, did you know about redlining and how this impacts our neighborhood? And seeing that interaction, I think, has been one of the most important parts of doing this type of training, is that you see students then figure out how these, like I said, systems of oppression end up impacting their health, and then sharing it with others so that they can all organize around this.
What would you say was your biggest barrier when you started this project?
Let's see. I think the technology piece, right, Nancy?
Yeah, yeah.
Technology piece.
Yeah.
Yeah.
Part of it is there are a lot of, you know, we knew we wanted to start off with an AIR focus, and there are lots of different online or tools that you can use. They do, it takes a little bit of, we had to train ourselves how to use these tools in a way that'll be useful to then train students or teachers or community groups. And I think it was a little tricky, right? It took us some time to download the data, see what it looks like, upload the data. It was, I think they're getting easier, and there's more and more out there, which is helpful. But at the beginning, we were kind of struggling with some of the IT piece, and that shouldn't, IT is supposed to make your life easier, right?
But yeah, yeah, but instead we were like, does this work? And for a lot of us, like I even downloaded the ONA platform myself, and I did my own community science research, like on my own individual level. I specifically was looking at flooding because I live closer to a coastal area here within New York City. So whenever I would see really big rain events here in New York City, like I couldn't really walk on my sidewalk because everything was flooded. And I live specifically in East Harlem, which is one of the neighborhoods that I talked about as part of this presentation. So I was like, how are not people documenting this? And so for me, it was nice to be able to do this and be able to use this type of data to better inform how drainage is being used here within New York City. But yeah, so it ended up like incentivizing even myself to do my own community science, which is really nice to be able to test it that way, and then be able to create a template for others to be able to use it as well.
And we both, I don't know, I guess I'm curious, or maybe I'll ask people in the audience, this online audience, have people tried doing community science on your own? Have you like been a part of bird watching, or there's all kinds of community science kind of projects out there that you can get involved in, and I'm just curious if people have tried it and their experience with it.
You can also put in the chat box if you've ever participated in community science.
More comfortable to write than to talk, yeah.
Yeah, and I had shared this with Nancy that I participate in the horseshoe crab monitoring here in New York City. And it's like one of the best activities that I do every single year. This year, unfortunately, it won't happen, but that's like one of the ways that I myself, outside from my job, end up participating in community science, is I help the Parks Department do horseshoe crab monitoring.
I see there's someone from our Department of Environmental Conservation, and that's exciting. So I do know you guys have a lot of different wildlife surveys, but also maybe, I think there's something with catching or looking and seeing the size of the eels that come in up the river. I think there's something that they do every year. Anyway, another thing that New York City has, and I don't think people recognize it, is that every 10 years we do a full census of our trees in the city, street trees. This is a huge project because there's many, many street trees, but it's done through our Department of Parks and Recreation. And we've both done it through different times. Luz and I did it maybe 15 years ago. She did it maybe 5 years ago. So we've had different time and different experience with it. But you learn a lot about your neighborhood, and you learn a lot about different trees that grow in the urban setting. And it's just it's a really fun thing to do.
Yeah, I see some folks that are mentioning they do bird counts using the Cornell app. I use that one too. Oh, I love that app. Such a good app. Yeah, I love birding. That's another of my hobbies that I like to do. And I see other folks mentioning the glass eel project, and then the Forest Service doing forest inventory assessment. Yes. Oh, this is so it makes me happy to see other people participating in community science.
Yeah, so this is Cynthia, if I could jump in, because I have a question. You touched on it a little bit. A lot of times when we look at something like this, when we're living in a state, which I should know this, but I want to say until maybe 10 years ago, we had more people that lived rurally in Kentucky than in cities. And I think that's flipped a little bit because we've had a, big migration away from the rural areas. But it seems like you have some proof of concept that this works. When you talked about working with the folks in Oklahoma, and like when you brought up well water, I mean, this is an issue that we have. People don't want someone from the government, on their private property and so forth. So I just would like to know a little bit more about that, because it feels like you took something that you're using in, New York City, for goodness sakes. It's just so different than where we live in most of Kentucky, and applied it. So I'd really like to know a little bit more about how that worked and what were there differences, or did it just translate completely the way it was?
So how we ended up collaborating with Oklahoma was, like I said, I had presented at one of their conferences, and they specifically are in Tar Creek, which is one of the largest Superfund sites in the country. So they have a lot of issues when it comes to water quality issues in general. And I wish I could show you a picture and give you a little bit more context of some of this environmental history. But ultimately, one of their main issues that they had expressed to me after I presented the concept of community science is that how do we connect folks that live in rural settings that oftentimes don't get to see their neighbors because they live in very isolated areas, or also too is the fact that because we're working with specific tribal populations, there is a very big mistrust of government entities coming into their personal homes and testing their well water and trusting also those results. So again, this is where community science lends itself to be the best lens to be able to do this type of research, because local environmental action demanded, the community-based group has already this trust with community members and have been leading this work. So instead of us as Mount Sinai or Department of Health coming in and teaching and collecting this data, it was actually local environmental action demanded that created that survey tool by having 10 of their community members trained in these 3 different modules, and they took all these different concepts and developed that survey themselves. And then they shared it with us, like, what do you think about it? Should we add additional questions? And so we ran it through our environmental pediatricians, and like, what other questions should we add to this? And so it was really a collaborative process, but after that, it was completely local environmental action demanded leading that community science work. And so far, I think that they ended up purchasing 2 iPads to be able to do some of the survey work, and they haven't had any issues when it comes to like geolocation. That was one of their main concerns when they were collecting this data, because whenever they were surveying folks, they wanted to also know where exactly that well was located and kind of like map it out. And one of the things that they were worried about is that because we don't have cell phone connectivity out in rural Oklahoma, how we're going to be able to be accurate when it comes to the placement of the GPS. But what they found is that once they got to a public library or they got back to a Wi-Fi spot, that geolocation was pretty accurate, and which is really good. And it showed that the tool actually is working. But as a backup, what they ended up doing as well is putting in the address itself, so that if they, for some reason, that geolocation was like not accurate, they would have that as a backup. And this data was only monitored, was only accessible to the folks leading the project. So it would be Rebecca, who is the executive director of Local Environmental Action Demanded, and then the 3 other people that were leading that community science project. And so I think it's time for us to just check back in and see how they're doing, and see how we can continue to support them. But again, as we're thinking through in a time of COVID and how we're not necessarily able to collect some of this data, this is kind of like where survey tools like this could be really important and helpful for folks that can't necessarily organize physically, but can organize virtually to be able to collect this data.
I'd like to thank our speakers. This was just fantastic information for us. And I know I learned a lot, and I so appreciate you taking the time out of your busy schedule to do this for us. And I'd like to thank our participants for joining us. I hope that you found this valuable and that you learned a lot. And Cynthia, do you have anything else?
No, we look forward to seeing you on the next one. So it's always fun. So I learned a lot. Thank you to our partners from New York. We really appreciate it.
Thank you so much for having us. It was a pleasure to be part of your webinar series. Thank you.
Now, I'm really excited about the potential for using some of this here in Kentucky. I think we do have some community science projects. In fact, the presentation we had last month about water quality is really an example of that. We just haven't used the technologies as much as you all have. We've done photo voice, but just with simple cameras or, cell phones, that kind of thing. So excited about where we might take some of that. So, yeah.
Great.
Yeah, thank you so much for having us. And of course, we'd be happy to share any additional resources when even the webpage is available as well. We're happy to share that with everybody, and they can end up using whatever aspects that they want as part of this training.
That would be great. Thank you.
Yeah, thanks.
Bye, everybody.
Bye.
Bye.
Thank you so much.
Have a good day.
Bye.